Mother Knows Death, starring Nicole and Jemmy and Maria QK.
Hi, everyone. Welcome to Mother Knows Death. On today's episode, we're going to talk about the most up-to-date information we have on the death of Diane Keaton. We have some unusual true crime stories coming out of hospitals, including a man who intentionally sprayed hospital workers with HIV-positive blood and a patient who beat to death their roommate. Then we're going to get into an unusual case of a surgeon who gave himself a vasectomy live on Instagram, and students who were drinking water from a tank that had a dead body in it. We'll finish up the episode with some of your emails and questions, all that and more on today's episode. Let's get started with kind of shocking Diane Keaton. I didn't hear she was sick, right?
Well, I saw your story first on Instagram that said Rip K from The Godfather, and I was like, you know what, you're kind of a boomer. I don't. Just kidding. No, I was like, I'm just
Nobody
confused
likes
what's
K,
happening.
by the way.
When I think of Diane Keaton, I do not think of The Godfather. I think of Something's Gotta Give. But we just have different movies we think of her.
She's K in The Godfather, so that's my introduction to her.
It's not that I didn't trust you per se. I just needed to look myself because I was just so in disbelief that Diane Keaton died. I was refusing to accept it. She was only 79 years old. We didn't know anything about her being sick. I was just completely shocked. I looked at her as this older person that was pretty healthy. So
yeah, I thought that way too by looking at her, but I mean she was 79, so we're starting to get into, the territory where people die. My favorite, old age. But no, I mean your body starts breaking down as you get old, so the likelihood of things going wrong are just increased at that age. And we don't know anything now, so obviously we'll have an update if we ever hear what actually happened to her. But apparently some of her friends hung out with her recently and were surprised with how extremely thin she was. Now, we know that she battled bulimia at parts of her life, so I think it's probably less likely that was happening, but people have seen her throughout her life fluctuating in weight. And also she has a history of skin cancer. So she had basal cell cancer. It's highly doubtful that had anything to do with it. She also had squamous cell cancer. Both of these are just from increased sun exposure, possibly some genetic component as well with skin cancers. But if she had melanoma, I'd say there's a chance that this had spread. Squamous cell could spread too, but it seemed like she got it treated, less likely. So we have no idea. There's no speculation. We have no idea. So we'll get back to you guys.
Yeah, and I would say, I don't know if maybe she found out earlier this year she was dealing with an illness or something. She had listed her dream home for sale in March of this year, which really shocked everybody. So I don't know if that was just her trying to make it easier on her kids or something, but it's really unfortunate, a huge loss.
Yeah, she was cool in all the other, obviously, like Woody Allen movies and stuff like that. She was super cool. So
I saw he was paying a lot of tributes to her. I'm like, nobody wants to hear from you, pedophile.
God, he's like Michael Jackson with me. It's just like I loved Woody Allen so much, and just I watch these documentaries and it gets in my head. Same with Michael Jackson.
Well, after we watched that one with Dylan, I was like, all right.
Yeah. No, I know. That one was so disturbing.
It is very hard to separate the art from the artist when the crimes are so horrific.
Yeah, really. All right, this one is so scary for people who work in a hospital, really.
So back in March, this guy was at the hospital getting treatment for diabetes, and he then allegedly removed his IV and sprayed HIV-positive blood into the eyes of 2 emergency room workers.
And he did this on purpose.
Well, that's what it's seeming like, and he's just getting arrested now 6 months later. Well, I guess he got arrested a couple weeks ago, so it was 6 months after the crime, and everybody was kind of like, why would he just be arrested now? The police are seeming to say that he's been either under medical treatment or psychiatric treatment this entire time, so that's why it took so long. But no normal person, in my opinion, would do something like this, so clearly something was going on.
Well, I mean, there is a possibility, I guess, and I don't know the details, that the guy was just freaking out about having the IV, because they are as much as they say they don't hurt, they
You
feel
feel them.
uncomfortable. And if he just pulled it out because of that and it so happened to spray, that would be totally different. But they seem to think that this was an intentional act, obviously, because they're arresting him now. So the good news is for these healthcare workers is that the risk of contracting HIV in that way is so, so low. It's like 0.03% chance. So it's happened. That's why there is a chance, but it rarely, rarely ever happens. So that's good news for them, but it's still scary because there is the small possibility of that happening. And to hear that, I guess it was considered a class H felony that could face up to 39 months in prison for each count. So that wouldn't be that long if a person did get HIV and had to deal with that for the rest of their lives. So at least now there's treatment for HIV and you could take medications to lighten the viral load to the point where it's undetected, but it is something that is a lifelong thing. And I feel like putting that negative health infection on a person that didn't get it, that's not really a lot of jail time, in my opinion, right? It's almost the same as giving them, going up to someone and cutting their leg off or something, just giving them a disability that they have to deal with for the rest of their life just because you wanted. Yeah.
Who classifies what's harmful, what's not to deal with? Because if these people did end up contracting it, it's something that's the rest of their life, right? It doesn't go away.
I'm not sure. So I know that the treatment could be so good at this point that it's not even detected. And I'm not sure that the laws have changed from when HIV was not considered to be even treatable, let alone curable, and now it can be, it's like something that is treatable, right? So it's not a death sentence as it once was. But you still don't want it. You don't want it. That's the bottom line. And if you don't want it and someone gives it to you against your will, then they should get in trouble for it. Period.
That's exactly what I was going to say. And then the New York Post was saying it's unclear if the HIV positive blood belonged to him. Well, where else would it come from?
Well, I was thinking that too, because the first article that we read about it, it said that the HIV positive blood was sprayed on the nurses in their eye. I don't know if it was a nurse or it just said healthcare workers. It was sprayed in their eyes. But in that one article that we read, it did not say that it came from him. I don't know where I didn't see that it came from.
New York Post was reporting that he was getting treatment for diabetes, and that's when he ripped out his IV.
Yeah, I mean, I don't know.
But I don't know if they meant...
I've never even... I mean, obviously, I've never given a person an IV before, so I don't know how they react. But if you just pull it out like that, I know it bleeds, but can you squirt it? I don't see how you could squirt it if it's not in an artery.
Well,
I don't know, just maybe it's sprays. I just don't know. If any of you guys are listening, what would happen if you just ripped it out, if you were able to spray someone in the eye?
Well, that's what I was wondering too. If maybe the way they meant it was he was in the middle of an episode, ripped his own IV out, and then got the blood from somewhere else.
Yeah.
But that's not the way I read it. But I also am in the same boat as you. If you rip your IV out, it's just squirting everywhere. This conversation is making me want to pass out. So.
No, it can't. I just don't see that. You think okay, if you cut an artery in someone's arm, Kill Bill style, it'll spray out like that, right? But that's not what's happening when you get an IV put in. So,
but then where is he getting the other blood from? I
don't know. There's a little bit of holes in the story, but regardless, at least the chances of them. I mean, you don't ever want to get blood into your eye because it's an irritant, but that's likely the extent of the problems for them. There was a case actually, though, documented that I found of a lab worker who got a droplet of serum in their eye. So that's after the blood is separated and spun down. And it was traced back to a patient that had HIV in the ICU that they were working on. So that's how they were able to say that's how he got the infection. But really, the way that they were able to correlate it was they looked at the genomic sequence of both the patient in the ICU and the lab worker and saw that the virus was the same one. So that's how they were able to confirm that it did indeed come from that patient. So, like I said, there are documented cases, but it's just rare because there's so many more documented cases of healthcare workers getting blood in their eye and never getting HIV like that. And obviously there's more cases probably of people getting semen in their eye, but the transmission's even lower with semen than straight up blood.
Well, what's your protocol if you guys accidentally are exposed to it in this case, or like when you're doing an autopsy or in the gross room, like dissecting organs and stuff, if you accidentally cut yourself with somebody that's infected?
We go to employee health if it's not that bad. And I mean, so I've had to go to the emergency room once because I cut myself bad enough that I needed a couple sutures. But it's all documented in case something happens because HIV, I believe that there's medications that you could take for that. But hepatitis C to me is the biggest concern, and there's nothing you could do except monitor and wait and hope that you don't get it. But it's all documented. So, for example, when I cut myself, of course I was cutting a hepatitis C positive liver. Like, why not be the dirtiest specimen, right? But we don't change our blades in between every specimen. So that's where the problem comes in, because you're like, all right, especially with the liver, I use the really big knife, right? And that has a blade that you could change out. But if I only cut one thing with it, it was pretty sharp, I wouldn't change it. So you could be like, all right, well, I did this liver, and before that, maybe I did like a uterine fibroid or something. I don't know, but you try to figure out every patient that you possibly were exposed to. And like the problem is the case of the lab worker. That lab worker got the serum in his eye and didn't develop the infection for a couple weeks, but then was like, oh, this is how I got it. I remember getting something in my eye. And then you have, okay, well, that lab worker probably did X amount of specimens. Like, I don't know if that person wrote down the serum that went in his eye, because trust me, there's been a lot of times that we'll open an ovary and it pops open and squirts out some fluid. One of my friends that was a resident sitting behind me got sprayed in the face with ovary, and it's just like, you're in the middle of a busy work day and stuff. You're not going to like stop for a couple hours and go to employee health. Like, it just, we didn't always
they didn't
go.
just drop dead immediately from having that all over
It's
their
whatever.
face.
If you work in the lab or do autopsy, you're going to get body fluids on you. Like, it just happens. It like land on your lip. It's gross, but like, it is what it is.
All right, let's move on. Last month, this 55-year-old woman ended up going to a New York hospital for an underlying condition, and while she was asleep in her room, her roommate ended up beating her to death.
This is really terrifying, actually. And what pisses me off about this is that this woman that beat up this woman to death, she was in the hospital 2 other times before this incident. One time assaulting a nurse, another time assaulting another healthcare worker, and there wasn't some kind of like little red check in her chart that said maybe she shouldn't be alone with people.
Well, the other healthcare worker that she assaulted was only hours after she beat this woman to death. So I was like, was she just freely roaming the hospital for hours after? Did they not realize it was her that did it?
I don't know, because like, again, where was she? So she was a roommate in the hospital. So the other woman that was 55 was admitted into the hospital.
She was admitted into the hospital, and then at 3 o'clock in the morning on September 10th, the roommate started beating her in the head to the point where she had to be intubated in the ICU, and then she ended up dying 2.5 weeks later. But later that day, she ended up assaulting another hospital worker, and she had a history of assaulting other hospital workers from previous visits. So I guess my question is the hospital liable because did they know she
yes.
had this violent history and
I
then
would
put her in a
listen.
room?
If this was, let's say, for example, this was like mom that was in the hospital because of whatever, she had diarrhea, whatever, right? She's in the hospital. And then all of a sudden, some roommate comes and beats the crap out of her and kills her. Guess what? All this stuff that's getting released that they knew that this lady was dangerous and still put her in the room with my mom. Guess what? I am suing the hospital because that's bullshit.
No, totally. I mean, this
It
woman should
is.
not have been exposed
And
to a violent person like that.
And this is the thing, too, that you guys are probably wondering, like, what was she in the hospital for? We don't know exactly what she was in the hospital for, but she was 55 years old. She was in the hospital, but when they did her autopsy, they said that her manner of death was homicide and her cause of death was due to blunt force trauma. So she died directly. It wasn't like she had a bad heart and the lady beat her up and then she ended up having a heart attack. Like, no, she died as a result of getting her ass kicked. That's how she died. And yes, it is 100%. I feel like the hospital is 100% liable for that. It's not like I mean, people could always, this could always happen, but the fact that there's documented history at this exact hospital too, they should have that in the chart somewhere.
I mean, don't violent patients like this have to be restrained and in their own rooms, or you would think so?
I don't know if a person that had it, like, if this person punched a nurse in July, as soon as they come back in the hospital, you're not going to be like, oh, I'm putting you in a straitjacket. Like, that's not going to happen.
Yeah, but like,
but there
listen,
should be like a separation thing. Like, this person needs to not be around people.
listen to the description of the second assault, which was a couple hours after she beat the roommate. So she slapped another hospital worker in the face and said, "Why are you squeezing my hand so hard?" Does that sound like a mentally sound person to slap
No,
a
but
person?
I mean,
I think people can be in really crazy emotional states in the hospital and maybe like, I'm not saying this is right. I'm just saying I could see how you could maybe like shove somebody or whatever could happen, and that is an assault.
listen,
But to slap somebody,
every single person listening to us right now is going to email us after this episode to tell us about how they have been abused by a patient and just
Well,
like weird
exactly.
shit that happens because especially, I mean, take aside the whole entire mental health aspect of all of this. When you're in the hospital, you're likely in pain, you're uncomfortable, you don't feel good, you're scared. There's just like all these other factors that go on to just being normal. And then if you have an underlying mental health condition, and everybody takes it out on the nurses or like and the other hospital staff like phlebotomists and things like that, the nurse assistants, they're the ones that get the brunt of all of it.
Yeah, and I mean, it's not fair because they're just there doing their job, and then people are either like going in crazy like this person is, or they're going through an incredibly hard emotional thing and they can't like control what's going on.
Yeah,
It's just a really tough place to be in.
it really is.
This episode is brought to you by The Gross Room.
Guys, this week's celebrity death dissection is Sylvia Brown. Just please check it out. It's just
won't believe it.
It's so good. When I just started thinking about this, I was just like, because I've been seeing a couple of videos on the internet, and I'm like, it just brought back all these memories of being a teenager and watching the Montel Williams show when I got home from school, and it's outrageous. And one of the points that I bring up is like, a lot of people didn't know that was going on because that show was at 3:00 in the afternoon, and like, who's home at 3:00 in the afternoon except I mean, this is back in 1990s, not now where people work from home and stuff. It just was a very specific audience of stay-at-home moms usually and teenagers that are watching this. So, and there was no internet for these stories to go viral. So it's just like, it stayed very contained and was allowed to go on for way too long and hurting a lot of people in the process. We also have a really good post on a sex injury that happened with this guy who was trying to imitate something he saw in a porno film, and it was an epic fail. So check that out in the Gross Room.
Head over to thegrossroom.com now to sign up.
All right. this is another crazy viral video that happened of a guy who is a surgeon that gave himself surgery.
Yeah, so a Taiwanese plastic surgeon is going viral after posting a video performing a vasectomy on himself.
It's kind of cool, honestly. So the reason that men get vasectomies over a woman getting her tubes tied is just, or a tubal ligation, you would say, is it just makes more sense because for a woman, unless a woman has a baby and is having a C-section and the doctors are already in there, then they could do the tubal ligation easily. But if you're just both healthy people and you're like, you know what, I'm done having kids, it's way easier for the man to get it because their tube is outside of their body. So it's not an invasive surgery as much as it is to do on a woman. So you're thinking about a guy, they have their balls in their sack, and the vas deferens is a tube that comes from the testicle and it goes and meets up in the prostate gland. So the testicle has the sperm go up this tube into the prostate gland where it mixes with the seminal portion or the fluid portion of semen, and those two join together and go out as ejaculate, right? So if you cut off the transportation system for the sperm to go to the prostate gland, in theory, you should be shooting blanks, right? It's still, the fluid's still coming out, but there's no sperm in it. There's lots of problems that could go wrong with that too, because you've heard of people that have had vasectomies and somehow there's a sperm in there. But that's a topic for another day. So what happens during the surgery is that they cut little sections of the vas deferens out. So think about it like a straw. If you just cut out a segment of the middle and they block off each end, and they do it just putting a little snip into the testicles and they're able, or into the scrotal sac, and they're able to get in there really easily. So this guy gave himself a local anesthesia and he did it himself. He had a urologist watching him do it. So in case he was doing anything wrong or was unable to finish the procedure, that he would be there to save him. And the best part of this story is that he did it as a present to his wife.
It is cool in theory. I just can't imagine. Well, I, as a medical phobic person, can't imagine at all performing any surgeries, but especially on yourself. And I know he administered a local anesthetic and everything, but just seeing it on your own body, I just can't possibly fathom doing it.
I feel kind of the same way. I saw Gianna was tattooing herself the other day, and I'm just like, I just don't think I would be able to tattoo myself and just feel the pain like that. But for this guy, as long as he's able to give himself the initial injections, and someone could have gave him the injections as well, if you're numb, you've had things done. Like, you can't feel it if you're numb. So I think it's cool. I think the only dangerous part of it is that he was kind of giving a step-by-step of how to do it on yourself. And you know, there's some crazy person out there that might try to do something like that, and now they have the instructions on how to do it. So he did emphasize not to do it on yourself, but you kind of put the instructions out there.
Yeah, so of course you're going to have one rogue person that's going to try to do it. But
Yeah.
the Department of Health reviewed it. They determined that no laws were broken. I think it was also just in this really weird legal gray area. So I guess we'll just see how this continues.
I'll post this in the gross room too, because I think it will be of interest to people.
All right, students at a medical college in India were horrified to learn that the water they had been drinking was contaminated with a decomposing body for at least 10 days.
I can't wrap my brain around this. Oddly enough, this is not the first time that this has happened, because do you remember the Eliza Lamb story, which is also in the gross room? We did a high profile death dissection on this years ago. Remember that Cecil Hotel documentary? Yeah. So a similar kind of thing happened, that she was found dead in this water tank, and people in the hotel were complaining that the water was a funny color and it smelled funny. That's what happened in this case too. In a medical school, they were saying that the water had a foul smell. And they found a body
disgusting.
that was so decomposed in the water that it was not, they weren't able to identify who it was, which means that they were really decomposed and just juicy, decomp juice in the water.
And right now, we don't really know how it got there. So they were saying that the tank was supposed to be sealed off, and it wasn't, of course. So is this the person that went in there and got stuck? Was it a homicide? What exactly happened? But to think, you might see your water and it's a little off, and you maybe don't think anything of it, and then it starts smelling over days, and then it turns out you've been showering and drinking water from a dead body water tank is probably the most disgusting thing that could ever happen.
There's no amount of, I mean, the only thing that really could help it would be to drink bleach, and that would kill you. So like, I just don't know, like, what could you really use as an antiseptic? Mouthwash? I would seriously be mouthwashing every day for like, and doing a cleanse. I don't even know. It's just, for you, see, for you think it's gross, and you've never seen or smelled a decomposing body.
No.
So just, and like salt, the juice, the black and the green juice that comes out, and the smell of it, and just thinking about that, I just don't know how you really ever get that out of your head. Although it might be really good if you're trying to lose weight, because I can't imagine. And knowing what it was, just drinking it in general would smell, but knowing it was from a dead person, like if it was from a dead rat, it would gross you out.
Well, dead animals get in water tanks all the time.
I don't want to know about that.
Because I've talked about this on previous episodes, but to think of a whole decomposing human.
Like a human is, it's just another level of nasty.
Okay, let's move on to questions of the day. Every Friday at the @MotherKnowsDeath Instagram account and on our YouTube, you guys can ask whatever you want. Also, I guess, new segment addition alert. I don't know the proper way to phrase it. You guys are always emailing us and messaging us your comments on stories from your professional perspective, your personal stories. So we're going to start reading those now on the show.
We're going to out you guys.
We're going to out you guys. If you want to remain anonymous, please say that you want to remain anonymous. Otherwise, we're going to say your first name only. But if you don't want your name out there, or you think it's going to be a problem and somebody's going to trace it back to you, we will gladly keep it anonymous. And if you could be helpful, if you're going to tell a detailed story, please don't give specific names of the place you work at or names of your coworkers or something. But you guys are always sending in good stuff, so we want everybody else to hear it too. All right, I guess let's start off with the first question. So what's the ETA on the new book?
2027. We're trying to
fall, right?
Fall, yes. We're trying, well, yeah, early, like late summer, early fall. We're trying to release it before CrimeCon of 2027. So that's the goal right now. It's going to be so good.
It is really going to be so good. You just sent a sample in, and it looks amazing already. I'm going to not say this person's name yet because they wrote in and I didn't have a chance to ask them or not, so I don't want to piss them off. But they said, "Hey, Nicole and Maria, I think this is the wrong email to be sending this to, but wanted to respond to your question on the show from October 4th about the portable x-ray machine. I've been working in radiology for 20 years, and for many years I've worked the grave shift emergency trauma. These days I only do CT scans. So the scatter radiation from a portable x-ray machine only goes about 5 or 6 feet from the source. However, if someone is in the next bay in the emergency room, which I assume is where you were sitting, the tech is supposed to tell them that they're taking an x-ray and back up, especially if they are women of childbearing age. Hope this is helpful. Love your show." Okay, guys.
So Maria was in the next bay, but I was sitting in a chair across from her bed, and I was about, I would say I was not even 2 feet away from the x-ray machine that they were using. Maybe they just looked at me and said, "She's definitely not of childbearing age."
You were like, "Little do you know that my blood test said I could still very well have a baby."
Yes, exactly.
But I am a woman of childbearing age, and I also was certainly not 5 to 6 feet from the machine.
No, you weren't.
And
I mean, that curtain was not doing anything.
On top of being ugly, it certainly wasn't providing protection. But if you guys had listened to that episode, you remember we talked about how I was in the ER. We thought it was weird. They just came right up to the person in the next little area, just took an x-ray and didn't say anything to us.
Yeah.
So thank you for writing that in,
Thank you for that, yes.
And this is
thanks for making it worse.
I know, thanks. All right, this is from Chrissy. Found out how first cousins could get married in Illinois for you. No, you generally cannot marry your first cousin in Illinois. The law only permits such a marriage if both parties are 50 or older or if one party is permanently sterile, as certified by a physician. Marriages between first cousins that do not meet these conditions are considered void under Illinois law.
So, all right, so that's what I was going to say, because my whole thing with that is like, how do they know that you're cousins? You just don't tell them and avoid all this. But I guess they're saying if they find out your marriage is null and void.
Doesn't count.
That-
I think
How are they going
the
to find out? Like the whole thing is like they put these laws in place and they're not going to do anything.
I think the 50 and over and the sterile is really interesting. Like, so you're allowed to do it if you can't make children. Then we don't care.
Yeah, that the only reason they care is because of the children situation.
It's just such an interesting concept. I mean,
I think it's interesting because I'm like, who do you tell? Okay, like I found out that my next door neighbor is married to their first cousin. Like, do I call my local police department and say, like, who do you call, right? The whole thing is such bullshit. The laws are just like there just because it's frowned upon, but nobody actually does anything about it, and nobody would ever know. That's my
it is
opinion
interesting.
anyway.
Well, thank you to Chrissy and the other listener for writing in. If you guys want us to read your comments, please email them to us. Don't submit them on YouTube or Instagram because it's a little too hard to monitor to us, for us.
And
But
we don't get half of them, especially on Instagram either. So
no, definitely. But you could submit those along with any, questions, comments, concerns, anything to stories@motherknowsdeath.com. We will see you guys at Darkside, New Jersey and Edison on Saturday. And please don't
Yay.
forget to head over to Apple or Spotify, leave us a review, and subscribe to YouTube.
see you guys. Thank you for listening to Mother Knows Death. As a reminder, my training is as a pathologist assistant. I have a master's level education and specialize in anatomy and pathology education. I am not a doctor and I have not diagnosed or treated anyone, dead or alive, without the assistance of a licensed medical doctor. This show, my website, and social media accounts are designed to educate and inform people based on my experience working in pathology so they can make healthier decisions regarding their life and well-being. Always remember that science is changing every day, and the opinions expressed in this episode are based on my knowledge of those subjects at the time of publication. If you are having a medical problem, have a medical question, or are having a medical emergency, please contact your physician or visit an urgent care center, emergency room, or hospital. Please rate, review, and subscribe to Mother Knows Death on Apple, Spotify, YouTube, or anywhere you get podcasts. Thanks.